Well, good morning, everyone, and welcome to our panel discussion today. I'm Dr. Samantha Meltzer-Brody, and I am the Sadma Monday Distinguished Professor and Chair of the UNC Department of Psychiatry. And it's a pleasure to be here today to talk about the enormous mental health and emotional health needs that we are seeing due to current events and the impact of the pandemic. We are now in our last day of November of 2020, and the end of the year is coming soon. The holiday season, while always a time of both joy as well as sometimes less joy as everyone gets together with family and friends, this year is particularly complex and difficult due to the pandemic. And we know that people are just exhausted, and really pandemic fatigue is widespread, as are the emotional and mental health concerns. Today, what we hope to do is provide some very practical tools, some information that you can take and use yourself. And we also hope to have a discussion with you via the chat and questions and answers about what you're seeing, hearing, thinking, and having a number of us be able to answer those questions to help increase knowledge that you can use directly. The other thing is we really want to ask for your help in appreciating the complexity and the enormous need we are facing in trying to address the mental health, what we call the tsunami, because of the pandemic and associated issues. So it's a pleasure for me to introduce two of my most spectacular colleagues. The UNC Department of Psychiatry is a very large clinical research department with over 315 faculty and a huge training mission. And I have two of our most skilled and talented people here today. Dr. Crystal Schiller, who will speak first, is an outstanding clinician scientist, an NIH-funded researcher. She co-directs the perinatal psychiatry program. She's also actively involved in the program for our well-being of our workforce across UNC, and part of the well-being program response, among many other things she does. Dr. Echo Meyer is vice chair of psychological services, a professor in the department, a really spectacular clinician and educator who has great expertise in a variety of different niche patient populations, and has been leading the effort around delivering stress first aid and other psychological interventions broadly to our workforce, in addition to many other things. Both Dr. Schiller and Dr. Meyer, it should be noted, had full-time jobs before the pandemic, and now they have multiple full-time jobs. So really appreciate them spending the time with us today, but you're in for a treat because they're both really outstanding. So without further ado, I'm going to pass the torch here to Dr. Schiller.
Wonderful. Thanks so much, Samantha. I'm really happy to be here today to talk about self-care tools during the pandemic. And so I have some slides to share. I'll get those rolling here. Great. Hopefully everybody can see this and hear me okay. We have multiple people in my household using Wi-Fi because my kids are doing Zoom school today. So hopefully this will work out just fine. So I'm going to be talking about one specific tool that you can use for self-care called mindfulness meditation today. And I'm going to be walking you through a couple of exercises. And the reason that we're focused on this as an important part of your self-care toolkit is because research has shown that mindfulness meditation in particular can really re-regulate your brain and reduce anxiety and stress. All right. So the first question I usually get is, what the heck do you mean by mindfulness? It has really entered the popular culture, and it's been used in so many different ways now, especially by people trying to sell you things. And so I want to dispel the myth that it's complicated or expensive. Mindfulness is just the practice of bringing awareness to the present moment through your senses. And I'm going to show you how to do that today, but you can do it in all sorts of different ways. There's tons of different apps, websites, recordings that you can use. So if this piques your interest today, you can Google and find tons of tools and resources freely available on the internet. The other pieces that I want to convey to you at the outset today are that mindfulness is a learnable skill. There's been a lot of research showing that people have the same effects on the brain who are just learning to do mindfulness as Buddhist monks or people who've been practicing meditation for most of their lives. And so that's another reason I think that this is a really cool and powerful tool that we can use right now during the pandemic to mitigate the effects of stress. All right, so why is the pandemic so stressful? You're feeling it probably in your mood and in your body, but I think it's important to sort of understand exactly what's happening to us right now. So this is a model that's adapted from cognitive behavioral therapy, but you can see at the outset, there's this stressful situation that happens. So in our case, it's the pandemic. There may be illness associated with that for yourself, for your family. Now that rates are spiking, a lot more people know people who are sick, and kids are feeling stressed. Your parents are probably feeling stressed. Spouses and partners, friends. Stress is really coming at us from all different angles because the pandemic is a chronic stressor now, but it's also an acute stressor because things are changing day to day that are stressing us out. And so when these stressors occur, it creates thoughts and feelings that are sort of automatic. You may feel anxious, sad, irritable when these things come up. And that may lead to thoughts, often about the future. How long is this going to last? What's going to happen next? How sick will this person get? What should we do about getting groceries today? What are we going to do for Christmas? So there's all sorts of future-oriented thoughts that can sort of start going when we're feeling anxious. And then that anxiety, sadness, irritability, a whole host of other emotions, because they often come in pairs or multiples rather than just one emotion at a time, can lead to us to take action or inaction. We may take a sick day, stay in bed, argue with kids or spouses. Some of the things we do are helpful coping skills, and some of the things that we do are not so helpful. And then that feeds back into the situation because, if that argument with the kids leads the kids to feeling more stressed and then we feel more anxious, you can see how quickly this can sort of spiral. And that's really where mindfulness comes in, because it allows us to break out of this stress spiral, even for just a few minutes, to sort of get our bearings, focus on what's important and what we can control, and make a decision about how to proceed, rather than feeling like we're sort of caught up in this wave of anxiety and everything else that's going on in the world right now. So like I said, a lot of those thoughts are future oriented. So mindfulness brings us back to the present moment, and that's the way that we break out of this stress spiral. All right, so I'm going to go right into exercises now. So the first one is connecting with the present moment through your 5 senses. This is one that I've been teaching a lot of people during the pandemic, and I like it because it's really simple to learn. It's one that you can use anytime, any place. And so basically you're just going to run through your 5 senses, and I'm going to guide you through this one, but you don't really need a recording to do it, which is great. So you can do it on your own later if you like it. The first thing I'm going to have you do is start. I like to just get comfortable before I start any kind of mindfulness exercise. You can put both feet on the ground, sit up straight in your chair, let your hands rest in your lap. You can keep your eyes open. because I'm going to have you start by connecting through the present moment through what you see. So I want you to look around the room that you're in. Notice where you're sitting, where the door is, where the window is, where the lights are. And I want you to find everything in the room that's red. Just sort of make a mental catalog of all the things that you see in the room that are red. Next, pick a different color. Let's say blue. Just quickly scan the room. Sort of like I Spy. All right. Now what I want you to do is notice what you can smell. I still have my coffee from this morning, so I can smell that. Maybe you have some tea, something else. If you've been in that room a while, you might have acclimated and maybe you smell nothing. I want you to see what you can taste. Maybe your toothpaste from this morning. All right. Now I want you to focus on what you can hear. You can hear the sound of my voice, but you may hear other sounds in the room or house that you're in. Sometimes it helps to close your eyes. If you're in Chapel Hill right now, you might hear the rain outside. Now I want you to feel the seat that you're sitting on. Notice if it feels cooler or warmer than the air. Notice the texture of the seat. Feels smooth or rough. Notice the feeling of the air as it touches your skin. How your skin feels as it touches your shirt. Now take a deep breath in through your nose and out through your mouth. So when I do this exercise with patients, I ask them, what did you notice when we were doing this exercise? And they'll often say, I forgot about all those things that we were just talking about. And that's really the point of this, is to step outside of that spiral of thoughts and feelings and situations and all the things that are coming at you all the time, to get grounded within yourself in this present moment, using your 5 senses so that you can be ready to face the challenges of the day, being led by your own values and what's important to you, rather than just being sort of reactive on your heels all the time. So you can use that exercise anytime, any place. As I said, I've been working with our physicians at the hospital. They use it when they're getting ready to do surgeries or to take care of patients. And wouldn't you so much rather have a physician who's really grounded here in this moment with you? And the same is true for all interactions, right? When we're interacting with people that we care about, let's be present. And this is one way that you can quickly become present and let all that stress go just for a moment, so that you can be there in the moment and face it in the way that you can feel proud of. Right, so mindfulness gets better if you practice it. And so another thing that you can try is to add this to your daily routine, sort of like brushing your teeth, because just like any other kind of exercise, you'll get stronger and better the more you practice. So some people tie it to another thing that they do already every day as a way of remembering it. You can also set an alarm on your phone to remind yourself to do it. Some people do it first thing in the morning when they wake up. Others do it at the end of the day when they're relaxing to go to bed. You could even do it, while you're brushing your teeth. And we'll talk more in a few minutes about how to sort of incorporate mindfulness into your other daily activities. All right. So now I'm going to share another activity that you can try. This is a more guided one, but again, you'll be able to do this on your own if you like it. So what I have you do is, again, get comfortable in your seat. And I'm giving you this extra exercise just so that you have some ability to pick and choose from a couple of different options. This one is one that you'd have to do sort of on your own when you have some quiet moments. And so it's not as flexible as that other one, but this one can create even more space for you to really explore what's going on for you in your body and your thoughts. If you're already feeling quite anxious, sometimes this one, you may find that your thoughts pull you away and you may sort of get lost in your thoughts again. And if that happens, that's totally normal. It's your brain doing what it does best, which is thinking and planning for the future. But if you find yourself getting distracted, just bring yourself back to the sound of my voice. All right. So we're going to start in the same way, both feet on the floor, sitting straight up, hands in your lap. And I'd like you to start by taking a deep breath now, in through your nose and out through your mouth. For this one, you can keep your eyes open or closed. A lot of people find that they can concentrate better with their eyes closed. I'd like you to start by focusing your attention on the top of your head. See if you can just notice how it feels without describing it to yourself in words. Now notice the feeling in your eyes. We often carry stress in the skin around our eyes, so you might find yourself squinting. See if you can just allow that skin around your eyes to become smooth and relaxed. Now notice the feelings in your cheeks and your jaw. Allow your jaw to hang loose. And for the tip of your tongue to touch the roof of your mouth. Notice the feelings around the back of your head, down the back and sides of your neck. This is often another place where we carry stress that we're not even aware of. By the end of the day, you might find that your shoulders are up around your earlobes. So see if just now, by focusing your attention there for a moment, you can get some relief. Let your shoulders hang loose and heavy. Notice the feelings in your upper arms, your elbows, lower arms, wrists, hands, and fingers. You may notice a warming or tingling sensation in your hands and fingers as you focus your attention there. That's just a sign of increased blood flow. Totally normal. Now notice the feelings across your chest. Notice how your chest rises and falls with each breath. See if you can notice that feeling without trying to change it. Notice how your rib cage expands and contracts. Your belly belly moves in and out. Now notice the feelings in your hips, your thighs, your knees. Notice the feeling of your kneecaps touching the inside of your pants. Turn your attention to your lower legs, ankles, and feet. Take another deep breath in through your nose and out through your mouth. Now you've brought your attention out of your mind and into your body. Notice how that feels. Maybe peaceful, maybe not. Now I want you to imagine you're at the beach. You're standing in the sand and you can feel the sand between your toes. It's a beautiful sunny day. Feel the warmth of the sun on your skin. And you lay back in the sand and look up at the beautiful blue sky. There you see some white fluffy clouds passing by slowly. Here's something to try. With each thought that pops into your mind, put it up on the cloud so you can see it in front of you. And watch it. It may sit there in front of you. It may pass slowly by in the breeze. There's no need to push it away. You can just see it there. One by one. Each thought that pops in, just put it up on a cloud. Just like your thoughts are like clouds, you are like the sky. You're the big, wide open place where your thoughts happen. But you are not your thoughts. They're just passing through. Let's take a deep breath now in through your nose and out through your mouth. You may feel relaxed now, or at ease, or peaceful. This place of peace is inside of you. It's a part of you that you carry with you everywhere that you go, and you can return here anytime that you'd like. All right. Now what I want you to do if your eyes are closed is to remember the room that you're in, where you're sitting, where the door is, where the window is, where the lights are. Come back into your body and kind of move your body around a little bit, wiggle your fingers and toes. And then when you feel ready, you can open your eyes. So this exercise was a body scan exercise. If you liked it, you can find it online. You can always add that cloud exercise to it if you liked it. This one, a lot of my patients like doing before they fall asleep at night. A lot of people have trouble falling asleep when they feel stressed or in the middle of the night. I'm hearing from a lot of my patients that they feel compelled to check their email or the news or read in the middle of the night. And that really disrupts sleep. So this is an exercise you can try if you're having trouble falling asleep at night. But again, just like any other kind of mindfulness or meditation exercise, it works a lot better if you practice on a daily basis. So if you like that exercise, I would encourage you to build it into your daily routine, like in the evening, for example, as you're winding down to go to bed. So those tools that I presented to you, I think are accessible, things that you can do on your own in your daily life to practice mindfulness. But mindfulness becomes a really powerful tool for resilience when you bring it out into the wild, into your daily life, because we're not monks living in a monastery or people with responsibilities and things that we have to do. And so the really cool thing about practicing mindfulness and meditation is that it changes the way your brain experiences the world and stress so that you can feel calm and centered even when there's tons of chaos around you, because you have that muscle that you've been building so that you can come back into the present moment. Notice when you're getting really far ahead of yourself and thinking about the future and everything that you have to do, and all the things that might happen. You can come back again and again. And that's what mindfulness is. It's just the returning your attention to the present moment. And so a lot of people say, I'm really bad at this. I keep getting distracted. And like I said, that's what your mind is designed to do. It's designed to think about and plan for the future. But the cool thing about mindfulness is that's the perfect opportunity to practice. And so if you get distracted and then you come back again to the present moment, that's the practice of mindfulness. So it's great if you get distracted. You can just use it as an opportunity to practice. All right, so mindfulness activities can really be done every day, and anything that you do during the day. Hobbies, driving to work, taking a shower, drinking coffee, eating lunch, taking a walk, all those things can be done mindfully. If you just notice how you're feeling in your body, using your five senses, or even what's going on in your mind during this time. It's hard to do that with thoughts at first. So that's why I start with that five senses exercise. You can bring that five senses exercise with you to your daily life. And I just want to encourage you that with practice, mindfulness generalizes to everything that you do, allowing you to feel present and calm faced with stress. I think that's especially critical for people who are serving as caregivers to children or other family members, older adults right now. I think there's a lot of stress associated with being sort of the person who's responsible for everything and everyone. And using mindfulness is a really powerful way to regain a sense of calm and groundedness as you approach all of these responsibilities and roles that we all have right now. So with that, I will turn it over to Echo. I'm going to stop sharing my screen. All right. Thank you. Echo, are you ready?
Yeah, you just got really small when you shared your screen, Crystal, but I'm about to share mine, I think.
Okay.
Okay. Thank you for setting that great foundation up for all of us on a Monday morning to feel present. Let me start sharing my screen to complement what you and if Mary Margaret's here or somebody else is here, it says I cannot modify the advanced sharing options. It's locked by my admin. Did you share it for me? Thank you. Can I advance it?
Dr. Meyer, if you can just say next slide, I can advance it for you.
Okay, let's do it that way. So what I'm going to do is bring to you guys today in the next 10 minutes or so a very, very brief overview of a model that we've been using for healthcare employees or health service providers known as stress first aid. And stress first aid is a model specifically developed to sort of be used on the fly when you're just doing your day-to-day life. Part of it actually includes what Dr. Schiller was just talking about within it. But it's important to say that this particular model is fairly unique in the sense that it was built for essentially crisis times in one's life and gives very pragmatic, kind of experiential moments, things you can do for yourself to cope during times of crisis. And we're going to focus on really quickly a couple of what the model discusses as stress injuries. And these stress injuries are why sometimes you're stressed and you don't really realize how stressed you are at the end of the day. They're called invisible injuries. They're not really invisible, but we don't see them. We don't pay attention to them. And in our regular lives, we might be able to sort of just let them go in other ways. But during periods of crisis, like a pandemic, they build and they become highly impactful. So one of the things we're going to learn how to do today is to understand what those stress injuries are, think about them a little bit together and with yourself. And then I'm going to teach you how to foster what this model calls the at least 5 of their many essential human needs, and just sort of give you guys some pearls of things you can do throughout the day to build essentially longevity and resiliency. And those are words that this particular model uses a lot. So yes, if you want to move on to our first slide, and I'm going to start my timer, make sure. So these are stress injuries that you're experiencing on a daily basis, 3 of them at least: loss, inner conflict, and your wear and tear. Loss is a grief injury. This is the way that you're losing parts of yourself every day. I used to be patient. I used to like work. I used to think telehealth was going to be so much easier. These are parts of yourself that you're a little bit at a time, sometimes during a prolonged crisis in particular, kind of feeling are absent, or even sometimes not knowing how to connect with. That's one type of invisible stress injury. Another type of invisible stress injury that you're experiencing is called inner conflict or a moral injury. And that is watching others and sometimes even your own self behave in ways that are against sort of your moral values. Being upset with yourself for being too snippy or snipey, being upset with yourself for not being good at multitasking the way that you used to, having strong feelings about others' behaviors, whether that be health behaviors or political behaviors or behaviors in general. And these things, these loss injuries or grief injuries, these inner conflict or moral injuries go on all the time in little bits building up throughout time when we're in periods of crisis and when the world and life is so different. The last is one that doesn't surprise anybody on this Zoom call: wear and tear, or what we call in stress first aid, a fatigue injury. All of us sort of can handle wear and tear and fatigue during times like we're living in now. There's just not necessarily sufficient rest and recovery time. And that is something that we will talk a lot about. But it's hard to achieve when there's so many things going on. So if you could move on to the next slide. My questions for you guys are today, what are your invisible injuries? Just taking those 3 examples. How is your work-life balancing attempts, whatever that means, creating one or both or all of these stress injuries? Which one is hardest for you? Do you really hate the moral injury? Do you really hate that you used to have, better attention than you feel like you do now, and that's really bothering you? And so that's sort of a grief or a loss injury. And how have your stress injuries changed from March to November? It's been a long haul, y'all, and it's what we're experiencing now is different potentially than what we were experiencing at the beginning or the middle of this pandemic experience. But your invisible stress injuries are not without impact, and they are impacting you in different ways throughout your day. And my goal for this part of our talk is just to get you to recognize that this is sort of going on behind the scenes a lot. And now I'm going to move into sort of teaching you all some things you can do to alleviate some of the impact of your invisible stress injuries. So the next slide has the list of them. According to the stress first aid model, we have 5 essential human needs, things we need to do to take care of ourselves when we're in a very difficult period in time. The 5 I'm going to talk about are cover, calm, connect, competence, and confidence. So again, the idea is that to continue to be in a difficult situation, to have longevity of coping, we have to take care of our 5 essential human needs, and we need to be really aware of doing that. And this is how you do that. So very briefly, one way you meet an essential human need is called cover. To cover yourself means to be mindful in your physical acts. Crystal was just talking sort of about that. You can be mindful in pulling weeds, in walking in the fresh air. It means to be present in the moment, right? That's to cover yourself. It also means to cover yourself psychologically. So to say things throughout your day like, if you're feeling as if you did everything wrong or you didn't get finished with everything, to cover yourself psychologically, you'd say, I made as many choices as I can today, and I did a good job making that many choices in one day. And also to cover yourself from some of the potential judgment that you may feel that others are having towards you, or even that you're creating yourself, especially if you're a little bit of an overachiever. You might say things to yourself like, I'm okay with others thinking I didn't do enough today. I know I did enough today. So cover really means to take care of yourself, to protect yourself from the negativity that sometimes we may place on ourselves. And also the sort of, if you're always thinking about the future, you're kind of never good enough. And that's why mindfulness is very important in terms of being mindful in our physical acts. Our next slide is called calm. Crystal already told us one way to be calm. Another way that this model would suggest to meet your essential human needs is to spend some time in a completely quiet or sensory-free space in your day. Doing 1,000 things creates the mind becoming more hypervigilant, constantly looking for stress. And it just is something that becomes ingrained, especially during a prolonged, difficult time. And spending time in a very quiet, very sensory-free, perfect space for you for 5-7 minutes a day is something that we really recommend doing during something like a pandemic. The next slide is called Connect. Connect is really asking you to ask yourself, how do you ask for help? How do you help others? How do you know how much information you need in a situation? And how do you know when you've had enough information in a situation? And being really, really honest with yourself about how honest you're being with others to share your genuine stress level. So connection means to seek and to find instrumental support, to determine your current level of informational support, which means turning off the phone sometimes, even if you're dying to read again. And then emotional support. So not just sort of saying, I'm fine today to everybody. You can say that to 90% of the people. But who is a person that you have that you can genuinely share your feelings with and connect with that person, hopefully laugh with that person. Humor is really important in terms of the emotional support part of connection. So the model again suggests that there are 3 ways we can connect with others. And it works because even if we can't see others, we can still do these things to connect. The next slide is called competence. So competence is incredibly important. We don't always feel competent when we're in a crisis. We may have been trained for a certain job set. That job set has changed a tremendous amount. We may have thought that we were really good socially, but now when we're seeing everybody over Zoom, we're not feeling quite as skilled maybe as we thought we were. Or maybe it's harder to be resolving conflict with your coworkers over Zoom, where it would have been easier to sort of pull somebody aside or kind of use a part of your history together to kind of resolve or diffuse a conflict situation. Those kinds of things just aren't as easy right now. Plus there is potentially a lot more strife. So the model really suggests that we really have to pay attention to the human need of building our competence, especially when we may be feeling quite incompetent at times. So one of the ways that the model really wants you to do that, that Stress First Aid really wants you to do that, and that we teach people all the time. This is very funny because when I do this on the MICU or in the emergency department, learning how to compliment yourself is not a skill of many individuals. They may be able to say, I'm smart, or I'm really good at my job. That's a great compliment, but it's not the kind of compliment that promotes necessarily longevity, because if you only tell yourself smart and then you do something wrong, that compliment doesn't stick. But if you tell yourself, why you tried to do something. Because I value being kind, I remember to ask a coworker how they felt yesterday, and how you do something. Because I have past experience, and I was very able to diffuse a conflict today. So again, why you do something, because you value being, for example, in this example, kind, and how you do something. So if you compliment yourself using those two critical components, it will create a longer term experience of feeling competent than the types of compliments that might be sort of, I'm really good at something that I am good at, but that could go away, or that something like COVID-19 wrecked. So something you felt like you might have been competent with before, and now you just can't be as, because potentially you're experiencing a wear and tear fatigue, or potentially injury, or potentially you're experiencing some moral injuries with your coworkers or colleagues. And it's just really hard to have the same skill set as you had before, in the context of the fact that you're experiencing some of those invisible stress injuries. The last thing I'm going to cover right now is called confidence. Confidence is incredibly important to have during a crisis, and it's incredibly hard to have during a crisis and a pandemic, especially. And so basically, these are the keys to having confidence during something like a crisis. Forgive yourself so that you can have hope. Make meaning in your moments so you can have purpose. And internalize your locus of control so that you can maintain your sense of self-worth, which means that pay much more attention to the things that you could be in control of today than all of the things that you feel like you can't be in control of today. So during a period of crisis, let's say it's a wildfire, because this is used a lot with firefighters and EMS and people who respond to shootings. They can't control the entire wildfire, right, as a firefighter. But they can control X, Y, or Z. And when they tend to focus on what they can control more than what they can't control, their longevity is increased. So last slide essentially is that doing these things to meet your 5 essential human needs while you're experiencing those stress injuries that I started this talk with will increase your longevity. And I think that we all agree that COVID-19 is going to be a mass experiment in longevity. So the next slide is just if people are more interested in learning about this particular way of coping during crisis, you can do so through the National Center for PTSD, which was where it was developed. And they have a number of different types of resources there. Or you can do it through the Schwartz Center, which has a number of different kinds of webinars that expand on what you've learned today. But I think just for today, in the 10 minutes, and we're ending now, that we have, I think that we're going to open the floor to conversations and questions. I think, Mary Margaret, you're going to do that for us, right?
She sure is. Thank you so much, Dr. Schiller and Dr. Meyer. Those are both really excellent. And so I'm thrilled that we've been able to have these fantastic faculty members in the UNC Department of Psychiatry share some very practical skills and tools, from a mindfulness exercise to then the material that Dr. Meyer just covered, which I think for all of us is extremely relevant and something we can all use each and every day during this challenging time. One of the things that we're seeing, and as department chair just weighs heavily on myself each day and on our department, is the massive need we see for mental health services. We see this broadly across our workforce. So if we think about UNC Health broadly, there are 35,000 colleagues, many of whom are struggling. And so our well-being program, with the support of the COVID-19 Philanthropy Fund, has really worked to rise to the occasion to be able to provide material that you heard today for multiple ways for our colleagues across the workforce, from nurses, physicians, people cleaning rooms of patients, and everything in between on the front lines to receive free mental health care and services in a variety of different ways, and then also to receive more formal mental health care for, for people that what they need is more intensive. But then it's just not the workforce, it's the children of the workforce. And then if we think about the general population, we are seeing a massive need in child adolescent psychiatry services. And unfortunately, we're seeing a huge need for adolescents who are backing up in the emergency department and having difficulty accessing care. We see a huge need in other specialty populations around our perinatal population, women during pregnancy and postpartum, those that struggle with eating disorders, but those that struggle with addiction, huge needs. And then just general anxiety and depression and PTSD symptoms broadly in everyone, across the general population. And so there's never been, in my mind, a need for us to develop as quickly as possible novel clinical programs, which we're working on, research that can really hone in on what are the best ways to have novel treatments and move science forward that builds on where we've been and then takes into account the stressors we have now, and then training the next generation. So there's just massive need, and this is something that I see both as an enormous challenge, but also a huge opportunity for psychiatry and behavioral health to respond robustly and to meet these challenges. And we certainly ask for your help in allowing us to do that. And so I want to now open it up for conversation and questions and answers that Mary Margaret Carroll will help moderate, and then Drs. Schiller and Meyer, and I'm certainly available to help answer questions during our remaining time. But it looks like we have a full 10+ minutes to try and address the questions you have and hopefully continue this conversation.
Okay, thank you, Dr. Meltzer-Brody. I'll take it over at this point. I'm Mary Margaret Carroll. I'm the Senior Executive Director of Development at UNC Health Foundation. And I am overwhelmed and struck by the knowledge and expertise that was shared this morning. I find all of this so helpful, and I hope everyone else on the call does too. I think that one of the things the pandemic has done for us is put mental health forefront, and I'm so pleased that we have all these experts who, oh my goodness, gave so many great tips. I want to listen to the recording again myself. So with that being said, we have a couple of questions that have come in, and I want to go ahead and open that to the group. One of the questions is, what role does exercise play in dealing with anxiety, and how much is recommended? I'm not sure who wants to take that.
I can take a stab at
Okay.
it. So exercise is a great way to manage anxiety and depression. There's been a lot of research to show that it does help. I would check with your physician before starting any new exercise routine, of course, and you can design a program that works for you. So one person may need an hour-long run. Another person could benefit from 5 minutes of walking. So it all depends on where you're at right now. You, of course, don't want to overdo it because that will create more anxiety and stress. But yes, exercise is a wonderful, another self-care tool that you can use.
Okay, thank you, Dr. Schiller. What should I do to help a family member who is in isolation with very limited social connections due to COVID-19 and is showing signs of anxiety and depression?
I hope that some of the things that Crystal and I talked about today will be novel ways that can be easily integrated into a person in isolation's life. One of the things when we were developing, sort of the things that we were going to do to be more helpful, we really had to pay attention to a lot of the things that we would typically recommend pre-COVID, getting together, behavioral activation, going to the bookstore, all those things that we would have recommended prior to COVID, we aren't our go-to things to help people who are experiencing anxiety during COVID, because people do have to be on isolation. And so some of the things that we talked about today are, in your mind and are able to be taught pretty easily and don't require some of the ways that maybe we would have treated an anxious person's anxiety. It is much more challenging to help a person who's experiencing anxiety and or depression during COVID. I think that all of the mental health providers on this call, whoever they are, would recognize that that is and is going to continue to be a challenge because some of the ways we used to do it aren't the ways we still can do it.
I'd also add that, human beings are wired for social connection. And so being in isolation on top of having COVID or, just the stress of the pandemic is really difficult for people. So I actually have a similar situation in my own family where a grandparent is socially isolated because they have COVID. And they are struggling with anxiety and feeling socially isolated. So I think what we've done is tried to identify ways to help them feel connected socially, even though they can't be physically connected. So teaching them to use FaceTime and text if that's a possibility, or Zoom, sending them notes and care packages. All of those things can be done and help them feel connected and supported.
It
And,
seems
I was
like,
just,
oh,
I was just
sorry,
going to
go ahead.
add one thing that I think is just to highlight is just that for all the things that have just been discussed in other ways, one of the things that we now have available is that mental health services have never been more available because of telemedicine and telepsychiatry. And so prior to the pandemic, the payers didn't pay for telemedicine or telepsychiatry. And I'll take a moment and pause. It took a pandemic for them to do so. And exactly how that's going to go long-term remains to be seen. But we are now the ability to increase access, especially in a state like North Carolina, which is, you have urban centers, but then you have large rural areas where people are hours and hours away from any kind of mental health care. And people can now call us and have a telepsychiatry appointment in the privacy of their own home. For that matter, it can be someone working who goes out to their car and takes the appointment at lunch if they don't have a place to sit. So that is a huge step forward. So I would encourage anyone who knows someone's really struggling to reach out for mental health supports and formal mental health supports. And we're able to do that broadly, and people are able to do that nationally. There's restrictions on making sure it's within the same state that the provider is providing care, but that's a huge innovation and step forward.
I'm so glad you just said that, because my next question was, how are you leveraging technology to protect mental health of patients and our frontline workers? And so it sounds like it's as simple as having one of these, right? So you can call in and receive help right away, or make an appointment. And how are you seeing that received by the patients?
I mean, in general, all the studies to date are showing that telepsychiatry has been widely utilized and accepted. People really like it. Now, certainly there are people that miss face-to-face interaction. However, for a lot of people, they love the convenience, absolutely love the convenience. And the fact that they don't have to drive hours, they don't have to take off half a day to go to a doctor's appointment is an enormous advantage. But Doctors Schiller and Meyer, go ahead and chime in on your thoughts on that.
I would just say, I think that particular question was about healthcare workers. Is that true, Mary Margaret? They asked
It is mental health of patients and our frontline healthcare workers.
Frontline healthcare workers. Yeah. So I just would add to that, we've developed through the well-being program a number of different ways to make for health care workers in particular, more accessible. So obviously there's the individual telehealth, and Crystal can talk about a variety of different types of webinars and support groups that we've developed. For example, when we go do the stress first aid training. So we've tried to be very flexible in thinking about how to provide mental health services, mental health care to frontline workers who really have different schedules at different times, who need ease of access, and who may not yet want or need or be ready for sort of an individual face-to-face relationship with the mental health provider. So we have a number of different types of peer models as well. And then obviously, Crystal, you can talk if you wanted to complement that, but really have been paying a lot of attention in the wellbeing program about how to provide accessible health service.
Yeah, we've seen tremendous growth in terms of healthcare workers looking for mental health resources, both individual therapy and medication management in psychiatry. as well as group therapy and support groups, not only for people across the healthcare system, but for specific teams as well. So we've really been trying under Samantha's direction to expand the service offerings that we provide. We also have been innovating ways of providing group therapy virtually within the psychiatry department. So we created a group therapy program for our perinatal patients. So patients who are pregnant and postpartum who would never want to come in to a group therapy environment right now. We have deployed that virtually, and it's been really fabulous to see patients feeling better and just really engaged and feeling a sense of community with other patients during this time. And we're also working on deploying some support groups in the cancer center as well.
I think that's great information, and I want to say thank you for making us all feel okay about how we feel. I took several pictures of the slides myself, just that I can refer to. But before we end here, I wanted to say to Dr. Meltzer-Brody, because we see these needs cropping up so much right now, particularly when you mentioned our young adults, adolescents. Are there things that people that are listening right now might be able to do to help support that? And if so, what would that look like?
No, thank you. That's such a great question. So the prevalence of psychiatric and behavioral health issues has gone up fourfold. And that's just massive. And so we are trying to operate at double the pace that we were before, literally in terms of number of referrals, largely with the same number of providers, and we're trying to get people in. But there's a huge need for additional resources on how we can help support outreach and how we can bring in additional faculty and additional people to help with what I'm seeing as this mental health tsunami. So donations in this area designated specifically for some of these key areas, particularly child adolescent psychiatry. We are working to partner with the Department of Pediatrics and the Children's Hospital to develop a real comprehensive approach. We want to figure out how we're able to have resources more readily available, including ways of leveraging what we're doing with technology and telepsychiatry to work with our kids, our teens, and their families to keep people out of the emergency room and intervene early. There's just a huge need for additional resources. And so help in that area can make an enormous, enormous difference, as well as understanding sort of the research behind what are the most effective ways of doing it. But right now, there's a number of things we can do now, and it's a matter of just having the resources to be able to do it. So the help in addressing this critical issue, as we've been talking, I've just been seeing emails coming in about more teens coming into the emergency department and the shortage of psychiatry inpatient beds and the inability to get people quickly into outpatient care is just horrifying. So we're trying to respond as quickly as possible to this. Please feel free to email me with questions you may have, and our department really, I could not be more inspired and proud of how all of them have risen to the occasion and how hard everyone is working to address this. And thank you again to Dr. Schiller and Meyer for spending their time. They are really just extraordinary faculty members and clinicians and researchers and educators, and really, really grateful to have people like them in the department.